And thank you. Oh, I'm going to say welcome everybody and thank you for coming, just so that I can get into the recording loop. We are here tonight for our Managing Your Health webinar. We've got a really exciting topic tonight, and we've done this once before, and I do love this topic. So first, I will just start by acknowledging the traditional owners on the land we meet. And for most of us here, that's the Ngunnawal and Ngambri people, and pay my respects to elders past, present and emerging. And I'd like to thank them for the ongoing care and unbroken connection they have to this beautiful region. Moving on to the excitement that is self-advocacy and self-management in healthcare. So tonight, the way we're going to operate is we've got Deputy Director Kate from HCCA here, and we've got three lovely panel members whose names all start with M, Megan, Marina, and Marcia. And we're going to do a bit of a question and answer chat for the first section of the evening. And then we're going to move over to lovely Chelsea, who's going to do sort of a presentation on the self-management side of things. So the chat will be more self-advocacy and the presentation part will be more self-management of health conditions, but it all sort of neatly flows in together. I'm assuming most of us here have done quite a lot of Zooms and onlines and Teams as meetings now, so we don't need to go through too much housekeeping, but in general, we keep ourselves on mute to limit the background noise and pop any questions that you think of while we're going through in the chat box. And we've got Evie here tonight, who's also from Healthcare Consumers Association, and she will be monitoring the chat. And if you have any techie difficulties, or if you need to start waving your arms around for help, Evie or we'll get back to you and help you with the Zoom side of things if you need it. We generally like to see people's faces, but up to you, your preference if you want to keep your camera on or off. You might have heard me say we are recording. So what we generally tend to do is record these presentations and put them on our YouTube channel. So just be mindful of that if you've got your camera on or if you're asking questions. But generally speaking, I edit it to just contain the main part of the presentations, and any questions and Q&A we do at the end is not going to be part of the recording. So I should have probably said in the beginning, my name's Michelle. Always skip out the important part. My name's Michelle and I work for the Healthcare Consumers Association, and we're the peak body for healthcare consumers in the ACT. Consumers is a bit of a funny word, but it just means all the people who use the health system, which is kind of everyone. So we do a lot of systemic advocacy, but part of my role in the chronic conditions health networking space is to run these webinars monthly to get subject matter experts in to give us really good health information. So that's part of our role as a peak body. I went through the part about how we're going to run tonight. So I think rather than just talking and talking and talking, I'll introduce Kate, and then Kate will take it away. So Kate started working at the Healthcare Consumers Association in February 2015. So it's your 10-year work anniversary this year. Yeah. Did we have a cake? I can't even remember now. That was a while ago. Yay, 10 years at HCCA for Kate. And Kate is our Deputy Director. She has deep interest in self-advocacy and healthcare systems and the way people experience healthcare, which has developed over many years as she supported family members needing treatments and care. So I'm going to hand over to Kate now, who will then chat and introduce you to our panel members. So that's all from me for the moment. Kate.
Michelle, for the lovely intro. It's a bit of a pass the parcel of introductions because I'm about to introduce you to our panel members. And just to say, look, we do have a pretty full program this evening. So if you have comments on what people are saying, or you have your own questions, or you have your own tips, because there is a bit in here about what are your tips. And I already know a few of the people who are joining us in the audience, and I know they could probably run this seminar all by themselves and tell you all of their wisdom. So one of the things that is most valuable about these sessions is when people share what they know. So if you don't get the opportunity to do that with your voice, please drop your thoughts into the chat. Okay, so let's get to our panel members. We have three. I'm going to start with Marina Semyonov. Give us a wave, Marina. Yep, thank you. Marina is the coordinator of the Canberra Lung Life Support Group, and she's been in that role since March 2022. She's taken part in a couple of key projects in that time, providing the voice of a carer on the ACT Breathlessness Intervention Service and on the Breathe project led by the University of Technology, Sydney. So all lung-related work. She is also a carer for her husband, who's had a triple bypass in 1992 at the age of 44. And he's also had several heart attacks, and he has, Marina, you might have to help me out with how to say this, bronchiectasis, is that correct? And asbestosis, and a range of other conditions. So she is really an expert in that lung space and also as a carer. We also have with us tonight on our panel Marcia Kimball. Marcia is the Director of the Hospital Research Foundation Group Parkinson's ACT Board and the Chair of their Board of Governors. She also sits on the board of Parkinson's Australia. So her husband, John, was diagnosed with Parkinson's 18 years ago. And you can see by the amazing sort of roles that those two have taken on outside of their carer responsibilities, that what tends to happen is that we or someone we know get sick, we find ourselves in a support and advocacy role, and then we take that passion quite often into a bigger picture kind of space where we try and actually improve things, not just for ourselves, but for our whole community of people who struggle with that thing. So that's part of what we're doing tonight, really, is taking the kind of lived experience of our panel members and trying to bring that to a bigger audience and benefit more people with it. So our last panel member this evening is Megan Kane. Give us a wave, Megan. Megan is a current health service employee at Peninsula Health. So she's from Victoria. And she does quality systems coordination there and incident management. And she is also currently receiving treatment for breast cancer. So she is right in the thick of self-advocacy at this moment. And she's quite a recent member of HCCA who's joined us through her passion for helping other people navigate healthcare too. So thank you, everyone. Thank you to our panel members for giving up the time that you're giving to share your knowledge and your experiences with us. I feel like I probably don't need to explain to you what self-advocacy is, but I will, because there might be some newbies among us. It's that ability to stick up for yourself, really. It's the ability to stand up and speak up for yourself and speak up for your family members and loved ones in that moment or in that interaction with healthcare where you need to actually stand up for what you need and speak up for your own knowledge and the wisdom you have about your own body and your life and your own choices that you want to make. So it's that kind of skill set and confidence and motivation that you may not have to start off with. A lot of us don't when we start on the beginning of a healthcare journey, but over time and over kind of difficult experiences, we often develop that kind of persistence and that kind of tenacity and confidence that you need, and you know that you're going to have to actually speak up for yourself. So straight into our questions then. I might start with you, Marina, if that's okay. Why is self-advocacy important for people using healthcare? You're on mute there.
Sorry, keep forgetting.
Oh, good.
From my perspective, self-advocacy is the only way that you're actually going to get what you need, because you're the only one that actually knows your own condition, your own body, and by advocating for yourself, you're actually communicating what is going on for you and telling, I suppose, your health provider, your doctor, what's going on in your own body so you can describe it well enough. And I think that's one of the big issues. It's about how well can you describe to somebody else what is actually happening to you and what's going on with you. But it's also not just about the physical symptoms, but it's about how you're reacting to it, what your concerns are, how you're feeling about it yourself. So it's building up that trusting relationship with your health provider so that you can actually get an outcome, which is, what is it you need from them? What result do you want? And making sure that you get it. That's sort of where I'm coming from.
Absolutely. And that thing you said about you had some words about it's not just about the physical symptoms, but about actually how you're going with it all. That requires quite a bit of courage and vulnerability, doesn't it, to actually say, hey, this isn't working for me, or to actually talk about not just the disease or the illness, but your actual sort of inner world and your how you're coping, essentially, I suppose, is part of that, and what that means for your treatment.
Which is why it's important to build that relationship up,
Yeah, so that you can say those things, absolutely. And relationship building is absolutely key to self-advocacy. Thank you. Megan, I feel like you might have something to add there. Why do you think it's important to be able to advocate for yourself?
I think it was important to advocate for myself because one size does not fit all with treatment plans. Every consumer journey is different. Every treatment plan is different for everyone, and every carer, individual, family member, patient going through a journey with the healthcare system has different needs and requirements, whether it's cultural beliefs, religion, different mechanisms on coping strategies, etc. I think I found it easier to have a multidisciplinary team looking after my care needs. That way I was kind of adding additional branches to the areas that I was going to need assistance with. And the people that I probably would only meet with on the very important dates, if I had access to a allied health staff member or a psychologist, for instance, that way you've already got access for someone to talk to about your problems before you wait for the bigger appointments with oncology teams, like a breast care coordinator or social work departments. So that was a big thing for me in regards to self-advocacy, having a support network within the healthcare environment.
Absolutely. That support network is crucial. And if you can have a multidisciplinary team and they're actually working as a team, that's really key as well. But you may have to do some advocacy to get there. Marcia, I feel
right.
Thank you, Megan. Marcia, would you like to tell us your thoughts on the importance of self-advocacy?
Yeah, I think self-advocacy, yes. If you're the person that you love or you're caring for, they're unwell and needing healthcare, they're typically at their most vulnerable. And health systems are often tricky to navigate, even for those who are well. So it's important to see that their health needs are met and their rights are respected, especially when there may be barriers to access or they can't speak up for themselves in relation to what is needed and what's wanted by them to live their best life as they can with the condition that they've got.
Yeah, and I mean, I guess in talking about self-advocacy, in that basket, I'm including the advocacy of your carer or your family member who's maybe walking that path with you, because as we all probably know, when you're feeling really unwell, it's not the best moment for you to actually be able to do advocacy for yourself. And you do, if you're lucky and well supported, you do, need someone there to help you with that advocacy. So when I talk about self-advocacy, what I mean is
Understand that.
you and your close people. Yeah, I'm just explaining it for others as well. But yeah, and I'm sure many of us have been in that boat where we are, advocating not for ourselves, but for our friends, for our partner, for our children. We're talking about that tonight as well. So thank you, Marcia.
I often find it easier to advocate for my children or my loved ones rather than myself. I think there's a little distinction there too. Like we say self-advocacy, but I can get stymied when it's my own self versus when I'm going into bat for my kids or something.
And I think that goes into actually the tips department, Michelle, because
skipping ahead.
I often would do things to advocate for my children, or I would push for what I would advocate for other people more easily than I would push for myself. So, often I sort of have to trick myself by saying, well, if this was my best friend,
what would I tell someone I'm the same.
Yeah. Anyway, it's not about us, Michelle, but thank you for that. That was a good
Stop
point.
interrupting, Michelle.
No, it was interesting on today's news. I heard that it's mandating that there's, like on the checklist when people are in intensive care, like children, that the nurses ask the carer or the parent, how well is your child getting better or worse? And the testing that they've done internationally shows that that's often a better indicator, the perception of the loved one, than the vital statistic, the vitals.
Absolutely it is. Absolutely it is. And I mean, we don't need to go into it now, but there are plenty of stories of where loved ones haven't been listened to with children, and that can have devastating consequences. You know your child best. And in the same way, once we become adults, we know our own bodies best. We know when we're not okay or something isn't working. And so that's part of our self-advocacy, is to actually speak up about the things we know, that we know our bodies.
There's a really good example coming up in Marina's next question for knowing your body. So everyone get ready.
Okay, well, that's a good segue then. Well, how about we go back to you, Marina, then, to give us an example of a time you needed to stand up for yourself or someone else in healthcare.
Yeah, when I was asked this question, I thought, what instance would I use? Because there are just so many. And I thought, well, there's actually one instance where I actually learned a lot from it for myself, and was advocating for myself. And it was an instance where I found myself in emergency. I'd woken up and here I was in the emergency. I had a husband and my youngest daughter sitting by the bed, they were shaking and they were crying. I had a nurse, and all she was saying to me was, do you know where you are? Do you know what's happened to you? What is your name? And I'm sort of waking up to this. And because the last thing I remembered was that I was actually in my backyard pruning a photinia hedge, standing on a wall. So what I discovered was that I'd actually fallen off the wall as I was trying to get onto a ladder, and I'd smashed my head and obviously got into concussion, So I had this doctor then saying to me, do you know me? Do you know who I am? And I'm going, no. Do you know what's happened to you? And I'm going, no. And he sort of said, well, I've stapled your head together. And I'm going, oh, thanks. And anyway, this was sort of going on. And then I suddenly realised I had to go to the bathroom, And I tried to move, and I found that I couldn't move my right leg from the hip down. Like it just wasn't moving at all. And I sort of said to the nurse, I said, I can't move my right leg. And she said, oh, well, come on, let's go to the bathroom. I said, I can't move my right leg. I can't get out of bed. And, she went, how urgent do you have to go? And I said, well, pretty urgent. She said, well, we'll just do an x-ray first. So she wheeled me off and did some x-rays, came back and said, there's nothing broken. And my concern was that I'd had hip replacement. I thought something had happened to that joint. So nothing was broken. So they sort of lifted me out of bed and sort of put me in a chair and went to the bathroom and came back. And the leg, it wasn't numb, but I couldn't move it, and back into bed. And, they were constantly asking me about my memory, and they were asking me to repeat things I'd said 5 minutes earlier and going through tests and stuff. And I'm just thinking about, I can't move my right leg, And this went on for a while, and then the doctor came, and it was 24 hours after I'd actually been brought in. I'd been in hospital for 24 hours by this time. And the doctor says, he said, well, I think you're ready to go home. Well, let you go home. And I'm saying, but I can't move my right leg. I can't walk, And they just, and I got very emotional, and I got angry, and I'm frustrated. And I think I might have been yelling at the doctor I can't remember. But in the end, the doctor says, okay, to the nurse, if you can find a bed, let us stay overnight, And anyway, I got back, they found me a bed. I went in bed. Next morning, a physiotherapist came, and by this time I'd had a sleep. I was on painkillers, I'd calmed down, and I could actually have a conversation with the physiotherapist and tell him exactly how I was feeling. And he started prodding me, and he said, oh, this is really unusual. He said, I'll just go off and get the doctor, And he brought the doctor in, and he started talking to the doctor and telling the doctor what he had actually noticed, and all of a sudden the doctor is asking me, and I could actually then start explaining what it was that was going on, and for me, that was just such a relief. And I mean, in the end, I had to have an operation, because what I'd actually done was I had torn both the gluteus maximus and the gluteus, in other words, my bum muscles.
Your gluteus maximus.
And
the butt muscle had detached.
Bum muscles weren't working, they were gone. They'd been torn off. But,
what an injury.
It was a huge injury. But the doctors and the nurses were so focused on the brain, which of course was critical, that they just were not paying attention or even thinking that I could have possibly done something that was really critical, And turned out I must have hooked my leg on the ladder or something when I'd fallen and torn it, But they weren't paying attention to that at all, So for me, I learned lots of things. We'll talk about that a bit later. But so that's my example. Okay.
Well, it goes into what happened, what was the outcome, what did you learn? So you're welcome to continue about, give us some top learnings from that experience.
So for me, it was very much about how to be able to actually explain, and for people to pay attention to, you actually had to be quite rational. And so it was about managing your emotions when you're trying to advocate for yourself.
Which can be hard to do, right? Like when you're
really
feeling,
hard,
if you're in pain or in a lot of distress, you're not always in a good spot to sort of calm down.
So it's about having time, giving yourself time to actually be able to overcome that emotional reaction and to think through rationally what it is you need to do and how you can actually explain it. And in my instance, I was very fortunate that the physiotherapist became, I suppose, my advocate.
Yeah. And so you found an ally on the team, which is always a good thing if you can find somebody who's on your side in kind of understanding.
When he came along, I could actually build a relationship with him. And we actually had chats and stuff, and I'd actually built that relationship with the physiotherapist, who then enabled that relationship to carry on with the doctor.
Yeah. And that relationship building is key, because then that person becomes an advocate for you as well, within their colleague kind of group. And so that's important.
And later on, the doctor actually said to me, he said, look, I'm terribly sorry. I just couldn't imagine that was what was going on. I was just so concerned about, the damage you'd done to your brain,
Yeah. And you can understand that, and it's good to hear medical professionals say, hey, I've learned something, or I didn't maybe do that as well as I could have.
Yeah, absolutely.
Yeah. Thanks, Marina. Megan, would you like to share an example of a time that you needed to stand up for yourself in healthcare? Sorry, did I say me?
Megan or Marina, Kate?
Sorry, apologies. I meant Megan. I think there's too many M names and I'm a bit tongue-tied, but Megan, I'll go to you.
That's okay. That's okay. So I'll give you an example for me. So I've just written down a couple of my points. So the change in the beginning of a journey by chance and choice of decision making. I'm 43, and it was through a chance and a great thorough checkup from my general practitioner that she found an abnormality in my right breast in August 2024. She sent through a referral and urgent request for a mammogram and ultrasound because I wasn't of the age advertised for breast screening to be done. And a cancellation was found, and I accepted, and I went and had the appointment, and 3 hours later I was called back into her office and given the news that all the scans that I'd had completed indicated lesions and growths in both my breasts and lymph nodes in the right arm. I had urgent biopsies and scans completed, and I received a confirmation of my diagnosis. And it turned out I actually had 2 different strains of breast cancer, the HER2 positive and HER2 negative. So I've gone through numerous treatments. I've had chemotherapy, radiation. I've had 2 surgeries, including a double mastectomy and removal of lymph nodes in the right arm. And now I'm back into chemotherapy again until later on this year. And I feel very supported by all my friends and family. This isn't a journey I ever thought I'd expect to find myself in, but I'm always patting myself on the back every treatment, every milestone for making it through. But the interesting thing about my self-advocacy story is that it's not related potentially to my healthcare team or the treatment. It was actually related to the factors outside of the treatment for my health condition, the financial systems, employment flexibility, and how to keep the rest of my life running on top of everything. When I had to slow down, rest, and recover from treatments and surgery, being a single mother to a 12-year-old daughter, and keeping her at a new normal pace for both of us. I'm not of a superannuation preservation age or classified as having a terminal illness. So when I contacted my superannuation company, they told me to call the Australian Taxation Office. And when I contacted them, they told me I couldn't access my superannuation funds because I wasn't deemed a stage 4 terminal illness. And when I called Services Australia, they tried to be as helpful as possible. But because I was still employed at the time, there wasn't anything for me to be able to access. So I was quite stressed out on top of all the treatments because I was trying to clean up the bills and make things a little bit easier for the journey that laid ahead. And traveling costs to and from appointments when you're feeling sick after each treatment, catching Ubers and relying on friends to get you there. And then you've got medical expenses on top of that. And also changes in dietary requirements because of the changes in taste, sensation, little bits of dry mouth and mouth ulcers. And you want to eat soft foods and your daughter needs to eat meat and 3 vegetables daily. It's very hard. Everything starts to pile up. So there wasn't much I could do, but everyone I called really tried to help us. But the hardest thing was probably disclosing to my employer about my diagnosis. I worked through all my treatment up and took my laptop to all my chemotherapy sessions. And when I wasn't feeling my best, I worked remotely, still doing all my jobs, my meetings, and being the matriarch that I always want to be. The only time I stopped work was up until my surgery. But something I really found was helpful to me during my process of treatment and still doing it is actually keeping work and keeping my brain focused on every day, not sitting around and doing nothing. I'm always out walking dogs and keeping active, making sure my daughter knows that we're staying as normal as possible. But my self-advocacy at work and my right to continue to work, that was a big thing that had to be discussed. Being able to negotiate the flexibility with my employer, that was a helpful step in my journey, and having an open and frank conversation about what would help me during my time of treatment was a key to a good outcome. So I found that really helpful as well, because I know that not everyone has that opportunity. So I was very grateful in that perspective. Probably what I've learned from this whole experience is just celebrating the little milestones and one cycle at a time, because I have so much to be grateful for. My daughter seen me lose all of my hair during chemotherapy, but I made sure that she helped me pick out headscarves and everything like that. And when the hair started to come away, she came to the hairdressers with me and helped me get everything off. And yeah, it liberated myself to know I could control that factor of my treatment. And the other thing I learnt was probably talking about my diagnosis and what I needed at work to keep my situation afloat, and having treatment at the same time, having open and clear conversations about what I needed. And it was helpful to facilitate that. The balance still remains challenging, but staying connected to my job, but also completing treatments and giving myself time to recover. It's tricky, but it's hard, I think, for my friends and my family, because they want to comfort you and give you hugs and emotional support, but you don't want them to think that you're a sick person, because I never felt sick before I got a diagnosis. And when my daughter sees me not feeling the best, I have to remind her that the medication I'm taking does make me feel sick, but it's a good sick because it's going to help me better. So it's important for her to know that even though I might have yucky days and visibly she might see me not looking the best, that the medicine's there for a reason, and that's going to help me progress through the treatment and have a positive outcome. So I always advocate to sit next to new patients, and it's amazing on the unit how everyone has little tips and tricks, and I always come up with cost-effective ideas for dry eyes and everything like that to save everyone money. And yeah, I've come up with little checklists for everyone to save money on costs for medical treatment, like Vaseline as a barrier cream, so you don't have to use eye drops all the time. So it's a positive experience for me to be able to give back to people that I see aren't coping so well with the hand they've been dealt. So that's my story, and I've had to advocate a lot, but I'm still going up the hill, but I'd just like to think that we're getting there now. So hopefully things will become positive.
Thanks, Megan. That really, talking about what you need in a variety of different contexts at work and with your friends and with your daughter, like that can really be part of that self-advocacy, can't it? And I think you also really illustrated that self-advocacy skills aren't just for healthcare. We actually use them all the time in different parts of our lives. You were talking about your employment, you were talking about your superannuation providers. Actually, these skills of being persistent and finding information out for ourselves that we can then use to make good choices, those are self-advocacy skills and sort of learnings that apply across your life. So really, it's very much a life skill, not just one about healthcare. So Marcia, on to you. Have you got a time that you needed to stand up for yourself or someone else?
Yeah, so thinking of my husband, John, who, as you mentioned earlier, has advanced Parkinson's disease, and he's wheelchair bound. I've been his carer since 2016 when I retired to support him after a major knee operation, which had nothing to do with Parkinson's, but it left him confused and less mobile. And this compounded his Parkinson's, which he'd been managing his diagnosis since 2008 when he was 58 years of age. And he was still very active, athletic sort of man, into development and doing all sorts of things. But Parkinson's, as many of you would know, is a progressive neurodegenerative disease which advances over time. There's no cure as yet, or it's not known. There's no known causes, only symptom management using a major drug, levodopa, which supplements the dopamine that's been lost as the neurons die off in the brain. And it's probably typically seen as an old person's disease, but there's 1 in 5 people are working age and managing families and mortgages and things like that. Fortunately for us, we were past that. And the symptoms are myriad. And there's an analogy of the iceberg. I don't know if Michelle's got it there. But it's, it shows above the iceberg, there's tremor, rigidity, postural things, and then below the iceberg, there's this myriad of other things, that constipation, depression, sleeplessness, hallucinations, it goes on. I think I've counted at least 25 of those with my husband over his journey. But each individual is different, and they experience, it differently as part of their long journey. One highly effective way to slow the progression of Parkinson's is through very regular exercise. And the key is to keep moving, because as you're getting more rigid and you're inclined, as you've lost the dopamine, you're losing the dopamine in your body, you're less motivated. John was always, come on, Marcia, let's do this, come on. And I'd have my head in a book and I wouldn't feel like I wasn't a big exercise person, but he was always very, and then things changed. It became more difficult for him to exercise. In 2022, he, after 6 months in hospital with aspirational pneumonia and other things that Parkinson's people fall victim to, the decision was made that he was a very big man and that we needed to put him into residential care. So I shopped around and found a residential care home that had a general manager who had both parents with Parkinson's, and she was very empathetic and it looked like the right environment for him. So, and he was just 73, and in we went, and the physios that were contracted to the home started off giving him, maybe 2 sessions a week, and the rest of the time he was sitting. He wasn't motivated to get up and walk himself, or he needed to be prompted and moved. He'd been used to cycling and tennis and boxing and Nordic walking and all sorts of things. So he didn't like going along to the group sessions because they all just looked, he thought they were all, 80 plus in there. So I tried to persuade the physio team to come and see him, at least 3 or 4 times a week, and to give him a program. But yeah, I was not very successful. In the end, I approached the general manager and she said, just keep trying, be friendly, as I was. And but then I put it in writing that I thought he wasn't getting, he didn't have a proper program and we needed a proper physiotherapy regime for him. And she came down and and got the physios to get him up and moving. And she advised that she thought that she agreed with me that he needed at least 4 sessions a week, of half an hour, 20 minutes, and variety in them too. So the physio team at the lead at the time reluctantly agreed, but then he just did the same old boring thing every day, and John was pretty bored with that. Didn't seem to understand very much about Parkinson's, and that this is not all physios, mind you. So I asked my neurologist to write and recommend aggressive physiotherapy to keep the hips moving and the glutes moving and all of those sorts of things. And the geriatrician also suggested painkiller, a small painkiller before his exercise program, so he'd be more he wouldn't be going, ouch, this is hurting, I need to sit down. So it took nearly a year to get the sustained outcome that was needed. And various physios came and went, and I had to keep starting again and trying. But this year, there's a lovely, young, enthusiastic team there, and he's having 4 sessions a week. And the first one is walking about 150, 200 meters with a assisted walking, and then a little gym session every second day. I dread inducting others into it, but I know that'll probably come. The other setback we've had is that some of the carers, because he is a big man and he's becoming less mobile, they bring in the lifter to lift him into bed or to transfer him to the toilet. And I have said, come on, together. It's 2 assist, and if I'm there, it's 3 assist, and surely we can help him to get up and sit on the toilet, and we can back him into bed. And most nights that happens, or most days that happens, and that's keeping him mobile. And the geriatrician recently wrote and said that he thought those contraptions were dehumanizing, and could they please stop using them? And because they'd pull under his skin and he'd get pains and things like that. I do appreciate that when there's tiny little carers, or they're pregnant or whatever else, that it's there's a need for those sort of lifters, and especially if the patient's not very mobile or willing. But so I've persisted, and so it seems to be happening at the moment, and so I'm fingers crossed that this continues. Yeah.
Thank you, Marcia. And some of those themes that others have pulled out of there too, that kind of real, you've had real persistence there over quite a long time, to get get your voice heard. And also that being well informed about what you think is needed, and knowing your person well, and speaking up for that. And a bit of relationship building in there too with the different team members, that, as you say, when a condition is long-term and requires support people like that, it's ongoing and needs to be redone as new people join and the older people leave. Is there anything else that you'd like to share that you've learned from the advocacy you've been doing for him?
Well, as you said, I think it's important always to be respectful, and it's hard at times when you got some inner annoyance with some of them, but to keep a rapport and explain the issue and why, the benefits of it all, because he can sit for 15, 16 hours a day in one spot, and he gets a sore bottom and all that sort of stuff. And so it's very important to keep him, and it's stimulating cognitively for him as well, because he's interacting with people as he's moving around and going to the gym, etc. So I think dealing directly with the professional people and trying to enlist medico people to support you in your and just persevere.
Persevere. It comes up all the time, doesn't it? That real need to understand that that's what's going to be needed. That sort of. Is there any? So, moving on to question 3, then, Marcia. Do you have any other top tips you would say to people who are in similar roles?
As I said, I think building rapport. It's best to try not to get people offside if you can. If they're not, to try and understand them too. What's stopping them from? Why are they not motivated to help these people? You can see that there's some wonderful carers in the system. There's other people that are most occupations that you get the ones that are highly motivated and those that are a little less so. But and building a team around you to help, I think. And humanise the interaction as much as you can, and use humour as well. Just keep advocating.
Thanks, Marcia. Yeah, it can be really hard to find that balance between trying to keep a relationship good and keep the rapport and the friendliness, but also knowing that actually this is not working or not okay. And a carefully chosen sort of time to express your anger or upset about something can actually be quite effective, but you've really got to balance with, you know, when that time is actually going to do some good. It can be a hard thing to work out. Thank you. So just to finish off
from Marcy. I was just going to say from Marcy's story, the big one for me that came out was you actually need to know about the condition or the disease. You actually need to have educated yourself. And that's absolutely critical. You can't really stand up for what you need unless you've actually done some research yourself and you actually understand the condition, the disease, and what is actually required.
And we certainly need more education about, especially in residential care and in hospitals, about some of the different conditions.
Yeah.
Because, you know, I hear the carers say to my John, lift your leg, stand up straight. And I'm go, but he can't. He's on off period. He's not, you know, he would if he could, you know.
Yeah.
You just have to and try and remind them and get education where you can get education into some of these areas.
I think that's right. Being well informed about the situation is really key to being a good advocate. Is there anything else, Marina, that you'd like to add about your tips for people in their self-advocacy?
That was a big one for me, and that having the information, the knowledge, which gives you the confidence to push for what you actually need, because you need that confidence, and being able to manage yourself and your own emotions, I think, is a really critical one, you know, so that you can actually stand up for what you need and maintain those relationships, you know, because it is a long term. It's not just a one-off.
No.
It's something that you have to keep at and keep at and keep at.
Yeah, absolutely. Thank you. Megan, to finish off with, is there any top tips that you've got that you'd like to share with people that you've learned from standing up for yourself?
Look, my top tip would probably be your own biggest advocate. I've learned through my experience, don't attach yourself to a place, person, or company. Attach yourself to your purpose, passion, and values. And that's how you keep your power and find fulfillment. And that's something that I have everywhere plastered as my motivation for every day.
Yeah. Keeping your eyes on something a bit bigger and, you know, more true to yourself than just the struggles of the moment.
Yeah. And I really follow what Marina and Marcia said as well. Both of the short stories that they've shared about their advocacy. I've heard many of stories and completely relate to what they've been talking about, having an elderly grandfather in aged care. And I think you have done a marvellous job advocating for your loved ones. And Marina also advocating for yourself. Yeah.
Thanks, Megan. And I think, you know, we are all most likely to find ourselves in positions throughout our lives where we are advocating for others and also need to advocate for ourselves. So I think, it is something that's worth thinking about and learning how to be good at if we possibly can. I can see the comments going up in the chat, and I, you know, encourage you all to have a read of them because there's some great contributions being made in there. So to finish off our panel session for tonight, does anyone have any questions for Marina, Marcia, or Megan? Now is your moment to seek their wisdom. You can pop your hand up or just Don?
Yeah, if I could just follow up a comment I put in the comment section. Sometimes you have to be emotional.
Absolutely.
As a gentleman in his 70s, the only way that I was able to get what I needed out of the public system was to be emotional and to be on the helpline, or if you like, the complaint line to Canberra Hospital, and to be crying and being heard. The guy at the other end took time. He took half an hour to listen to my circumstance. He took it on board. He took it to the management. He took it to the executive. 2 days later, I got an appointment for the operation that I needed in 2 weeks' time. And I'd been waiting 6 months. The incident was I had an ICD implanted. This is after 7 stents and a triple bypass, a dual lead ICD. The atrial lead was pulsing at 60. The ventricular lead was at 40. In the middle of the night, suddenly my heart rate dropped to 40. The cardiologist looked at it and no, it's just your watch. It's giving you the wrong information. And it took 6 months to go and persuade someone to actually have a decent look at my situation and rectify it. And increasingly, I'm becoming disavowed of the public system in the ACT. But you have to push. And as I said, as a gentleman in his late 70s, crying at the end of the phone was the only way of finding someone who would listen to what was in my voice and in my heart and what was really what I needed. And to get that person, I guess a lowly paid public servant in the hospital, to go and advocate for me on my behalf. Otherwise, I would have been waiting another 12 months.
Thanks, Don. I think that's a perfect example of when it's a good time to actually let those feelings out. And I really commend you for your courage in being able to do that, because it's not easy to be vulnerable, but to actually let someone else see the actual impact of what is going on for you. It's undeniable when it's in front of you in someone's sort of voice and emotions like that. A friend of mine had a similar experience recently where he was having a miserable time with a lot of heavy medication for epilepsy, and he had no quality of life, and went back to his neurologist and sort of broke down in tears about his loss of everything he valued in terms of what he was able to do. And it was only that kind of real breakdown actually that got through to her that actually this needed a full review and a change of medication, that it wasn't okay. And so I think, there is absolutely a time and a place for letting that upset and frustration out completely.
I
so well
think
done.
that speaks to Marcia's point about humanizing the treatment and humanizing the interaction. Like often we are in really vulnerable and emotional situations in healthcare, and we certainly never want to say like, oh, you shouldn't be emotional or upset when you're talking to a doctor or whatever. I think the different advocacy points are around if there is a lot of emotion and vulnerability, that's humanizing the experience, and sometimes that can get you to the next step and really be a great help in advocating for yourself, because someone can see this person really needs help. And then in slightly different situations, like for example, Marina's, she just needed time to gather her thoughts and get coherent to be able to communicate. So we're certainly not saying never be emotional and always be nice to doctors. It's like, it's about that
strategic deployment of emotion.
Yeah. So it's strategic. Like there's different situations that can humanize the emotional side of things, and then also sometimes you need time to get yourself together. So both sides of the coin. I'm going to push in the question queue, Kate. One of our consumers really wants to hear about the care escalation.
Okay, well, what we might do just before we do that is just to see if there are any more questions for Marina, Megan and Marcia, and then I can talk briefly about the care phone line, if that's okay. Yes, thank you. There's a comment there, being polite and showing emotion aren't mutually exclusive. Absolutely. I mean, and these situations and conditions we have are impactful of the things we hold most dear. Of course, we are going to be emotional some of the time. I agree. Is it Zarana? Very grateful to the M's for being so open with us. Yeah, we are very grateful to our panel members too. We really value that you've spent time and shared your personal stories with us, because I really do believe that the best way we learn is from each other. And so, you were talking about that, Megan, in terms of sitting with people, new people in your treatment, but hearing from each other is one of the best ways to do it. So being mindful of time then, I would like to really thank you once more, Megan, Marcia and Marina. And I will just do a quick, are you after, Michelle, what is the care program? Is that what you wanted me to talk about?
A little bit, like a tiny bit about what the care program is, and if it can be used in emergency or whether you have to be admitted, I think is another key point.
Yes,
I don't actually know
I feel
the
like I may get this information slightly wrong. I can certainly talk about what the care program is, and Fiona might be able to help me here about whether it's useful in emergency. So earlier in the chat, there was a question about being able to escalate care when you're in the emergency department and you're not being heard by the staff. So there is, Canberra Health Services has an escalation channel. Every health service in Australia has to have a way that a consumer or a carer can raise their concerns about somebody who is getting sicker, or deteriorating. So we're not talking about complaints about the food or complaints about the bedroom or whatever it is. We are talking about the specific situation when someone is getting sicker, either mentally or physically, and you are worried that it is not being picked up. So in Canberra, and they also mentioned that this system that every hospital has come about because in past times, parents, especially with parents of children, have not been listened to when they've tried to raise concerns about their kids getting sicker, and that has had devastating and fatal consequences for some families. So now each hospital has to have a system where you can. So there was a link in the chat if you want to know more about what the phone number is, but essentially it takes the pathway. So the idea is that first of all you talk to the nursing staff who are the team that is looking after you. If you don't get satisfaction there, then there's a number to call, and that brings in a review from someone external to the team that is looking after you. So that's kind of how it works. I am unclear about how it works in emergency, and I'm not sure whether anyone here is able to tell me. Fiona, do you know whether that's... No, okay. I think what we'll do is we'll just commit to finding out, because it often is in emergency that things go wrong in that way, where a parent is waiting in the waiting room with a kid that is getting sicker. So I feel certain that it has an application to emergency.
What I'm going to do is, after our discussion, all the resources and anything that we've mentioned in this chat, I'll send out an email to everybody. And so I'll find out some more details about that escalation and talk about it.
Thank you. Yeah. So we'll send the answer to specifically how that works in emergency through in the post-meeting information. But yeah, in other states and territories, it's called things like Ryan's Rule is the same thing. I think that might be, so there are different names for it, but it is the same function. Okay, moving on then. Thank you once again, panel members. You were fabulous. And over to Chelsea Hillenar, who is joining us from Canberra Health Services to